Despite the widespread prevalence of pain and high volume of pain medications used in the U.S., a new nationwide survey found that many people lack a basic understanding about commonly used non-steroidal anti-inflammatory drugs, and nearly half do not know what they are. Here to discuss the survey and explain non-steroidal anti-inflammatory drugs is Dr. Anita Gupta and Penny Cowan of the American Pain Association. Penny, what is the purpose of the Understanding America's Pain survey?
IROCO funded this survey to really gain a better understanding of people's attitudes and behaviors and what they think about, pain management. And what we found out is 8 out of 10 people in this country have experienced some form of pain. But of those, a little less than 50% of those experience pain on a weekly basis. But what was really interesting is that a third of those people actually ignore their pain altogether. And of those, 60% of the people don't even talk to their healthcare provider about their pain management. What are all of the options? And NSAIDs may be one of the options they have, but what they were not aware of, and in the survey we found that half the people didn't even know what an NSAID was, and 27% of the people had no idea that the FDA made recommendations that you should take the lowest effective dose for the shortest amount of time. So we're here today to really talk to people, to generate an awareness about talking to your healthcare provider and about understanding the importance of taking NSAIDs appropriately.
Were the results surprising?
The results were very surprising, in fact alarming, that 47% of people don't even know what NSAIDs are. NSAIDs include things like ibuprofen, Aleve, Advil, Motrin, and also prescription NSAIDs. So having that conversation with your doctor about what the available options are, and also if you're taking over-the-counter NSAIDs in conjunction with prescribed NSAIDs, these are really important conversations to lower some of the risks that can occur. Now, the risks can include heart attack, they can include stroke, it can also cause a bleed in your stomach or even kidney problems. So although they can be very, very useful and very safe, talking to your doctor about those risks or starting that conversation is very, very important.
Doctor, just what are NSAIDs?
NSAIDs are non-steroidal anti-inflammatory drugs, and they work by really just decreasing inflammation. When they decrease inflammation, pain is felt less and oftentimes not at all. So it's really important to take the lowest effective dose for the shortest duration of time to make sure that you have the best benefit with the lowest risk.
Doctor, why is it important to talk to your doctor about pain management?
Number one, because so many people are taking these medications. 123 million prescriptions of NSAIDs were written last year. 1/3 of individuals are taking over-the-counter NSAIDs. So there's just a prevalence of use of these medications. So talking to your doctor will give you the information you need. It'll open up the lines of communication on how to treat your pain better, and also discuss other options that exist to treat your pain.
Doctor, is there anything else our viewers should know about NSAIDs?
Well, one of the most important things is really to talk to your healthcare provider, your pharmacist and doctor. That's where you can get the most information on how to take these medications safely. In addition, I know Penny also is an advocate for the American Chronic Pain Association.
Right, and there's so many different things that people can do to better manage their pain, and they have to take an active role. So it's important to have that conversation with your healthcare provider and really understand what the role of NSAIDs are, and how to take them appropriately, to take the lowest effective dose for the shortest amount of time. One of the things we found in the survey is that only 31% of the people felt like their pain was even being controlled. So that's even more of a reason to have that conversation. So those 60% of people who aren't talking to their healthcare provider about their pain management, we're hoping that this will get them talking back to their healthcare provider or to their pharmacist. And that's really the key message here.
I would like to thank you both for taking the time to discuss NSAIDs with our viewers. Have a great day.
Thank
you, Deb.